glossopharyngeal nerve. This is pons and medulla. And glossopharyngeal nerve has motor nucleus, is nerve nucleus ambiguous, number 1. Then sensory nucleus is nucleus solitarius, it is sensory nucleus. And parasympathetic nucleus salivatorius inferior. Nucleus salivatorius inferior. Motor, sensory, and autonomic fibers together makes ninth cranial nerve. And this nerve passes through jugular foramen. And sensory fibers in the region of jugular foramen has ganglion, 2 ganglions. In my diagram only 1, but usually here we have 2 ganglions, superior and inferior ganglion. Number 4, sulcus posterolaterales, 5, jugular foramen, and 6, you should remember that 6, it may be ganglion superior or ganglion inferior. Maybe both, superior and inferior.
Okay.
And this nerve gives branches. First is one motor branch for innervation of one muscle, that is musculus stylopharinger muscle, and the same branch, ramus musculi stylopharinger. Number 7, ramus musculi stylopharinger, and this is muscle, stylopharyngeal muscle. That is motor branch. Then sensory fibers, sensory. What is the name of this nerve? Ninth nerve? Glossopharyngeal. Glosso, that is what? Glossa. Glosso, that is tongue. And pharyngeal, that is pharynx. Here it is pharynx. And now, sensory fibers goes to tongue and supply posterior 1/3 of the tongue, rami lingualis. Pharyngeal branch goes to pharynx. The same, it gives sensory branch for place where common carotid artery subdivides into external and internal carotid. This place of bifurcation has name carotid sinus, sinus caroticus, and branch which goes to carotid sinus has name ramus sinus carotici, and also it supplies tonsils, palatine tonsils. That is, branch is rami tonsillaris. I put numbers. 9, ramus pharyngeus. 10, ramus sinus carotici. 11, ramus tonsillaris, and 12, ramus lingualis. It supplies posterior third of the tongue.
Okay.
And last nerve, which start from glossopharyngeal, this is tympanic nerve. Tympanic nerve is mixed. It consists of sensory, green color, and parasympathetic. Together they make one nerve, that is tympanic nerve. Number 13, tympanic nerve. Tympanic nerve goes into tympanic cavity, that is middle ear, tympanic cavity. And sensory fibers makes here tympanic plexus and supplies these cavities. Number 14, that is plexus tympanicus. And parasympathetic fibers leaves tympanic cavity and forms lesser petrosal nerve. Number 15, nervus petrosus minor. If you remember, here we have groove and hiatus canalis of greater petrosal nerve, and laterally groove and hiatus canalis nervi petrosi minoris, lesser petrosal nerve. And lesser petrosal nerve, it goes into the skull through this hiatus, continues into sulcus, and it leaves skull through fissura sphenopetrosa. Here, fissura sphenopetrosa, and from here goes to parotid gland. Parotid gland is in front of and below or from external acousticus meatus. Well, lesser petrosal nerve, nervus petrosus minor. It passes through fissura sphenopetrosa and goes to ganglion. It is ganglion oticum, near of parotid gland. Ganglion oticum, not opticum, but oticum, otos, that is ear in Greek, ear, near of ear, ganglion oticum. And here it is, we have branch from trigeminal nerve. From trigeminal nerve, next time I will explain. Name of this branch is nervus, I put here number 17, nervus auriculotemporalis. Nervus auriculotemporalis. It is sensory nerve which goes to parotid gland and to the skin near of parotid gland. Nervus auriculotemporalis. And from ganglion oticum, number 18, ganglion oticum, postganglionic fibers, parasympathetic, attached to this nerve, auriculotemporal nerve, and goes to parotid gland and supplies it. Number 19, parotid gland, glandula parotida. That is ninth cranial nerve.